Welcome everyone, welcome to Las Vegas and welcome to AHIP 2024. I am really honored to kick off our conference. Thank you for joining us. Thank you for investing your time with us. The greatest gift you can give us is your time. Thank you for all you do to make high quality healthcare accessible and affordable. AHIP 2024 is an opportunity to learn, to grow, to connect with people across healthcare. So over the next several days, as Robert was sharing, we'll experience a really curated agenda focused on the topics that matter most to our industry and our partners throughout the healthcare system. We'll hear from incredibly accomplished speakers from both the private sector and government. Speakers who will inform us, who will engage us, and who will also challenge us. We'll cover all the topics that are top of mind for yourself and your organizations and the people you serve. Access, affordability, equity. We'll learn the very latest on clinical and technological innovations and the consumer experience. We'll hear from leaders tackling the most vexing challenges in the system and those on the cutting edge of innovation. And finally, as you may have heard, there's an election this year. So we'll close out AHIP 2024 with a bipartisan panel featuring two of the most thoughtful and insightful political commentators in the country. AHIP 2024 comes at a key moment. In recent years, more Americans than ever have gained the security, the peace of mind, the well-being that comes with quality, affordable, comprehensive healthcare coverage. And in all the markets in which our members serve people, there's meaningful progress to build on. But there are also challenges on the horizon in each of those markets. The commercial market. Employer-provided coverage remains the backbone of our healthcare system. Some 180 million Americans receive their healthcare coverage at work. And every survey shows that the American people, that workers, greatly value employer-provided coverage. This year marks the 50th anniversary of the bipartisan enactment of ERISA. And it's really hard to overstate the role of ERISA in ensuring that generations of American workers and their loved ones have been able to count on stable, quality, affordable coverage. Yet at the state level in particular, we're seeing policy proposals that would disrupt that proven ERISA framework. In Washington, there's also even talk of changing the tax treatment of employer-sponsored healthcare, an idea that is resoundingly unpopular with workers. Employer-provided coverage works for workers, for employers, for the healthcare system. It should be supported and strengthened, not undermined with risky policies. The individual market is stable and growing, and consumers have more choices than ever before. About 22 million Americans now get comprehensive, affordable coverage through the marketplaces. But the enhanced tax credits that have made a real difference for millions of people and their families are set to expire at the end of next year, which is really creeping up on us. These tax credits need to be extended so consumers have the peace of mind of knowing they can keep their current coverage. In Medicaid, continuity of coverage through the pandemic was really essential for people and also for the broader healthcare system. Now, as states continue to work through redeterminations of Medicaid eligibility, we need a sustained focus on increasing and streamlining Medicaid ex parte renewals. The flexibilities that were put in place during the pandemic to engage and support beneficiaries should be made permanent. Let's make it as easy as possible for people who are eligible to stay in Medicaid. And then if people are no longer eligible for Medicaid, let's make it as easy and simple as possible for them to transition into new coverage. Turning to Medicare. Sometimes the discussion about Medicare Advantage seems to lose focus on the beneficiary, the senior, who paid for their Medicare coverage throughout their working years, the person with disabilities. It's vital that the beneficiary remain at the center of the Medicare Advantage discussion, because beneficiaries are choosing Medicare Advantage for very simple and very compelling reasons. Medicare Advantage gives them better health care at lower costs. And isn't that what we all want? And when it comes to what matters most to seniors and what matters most to beneficiaries with disabilities, Medicare Advantage is decisively outperforming fee-for-service. And yet we're already seeing signs that some of the policies enacted in recent years will result in fewer choices, perhaps fewer benefits when seniors renew their coverage this October. There are also very substantial reforms, policy changes going into effect in Part D. So in this time of uncertainty, we need to keep the Medicare beneficiary at the center of the discussion and support the choices they're making. Of course, in both commercial markets and public programs, affordability remains the issue. AHIP's affordability agenda is robust. It includes advancing policies that drive value over volume, combating the widespread abuses of the drug patent system that are intended to prevent competition and keep drug prices unsustainably high, enacting site of service reforms that advance quality and convenience for patients while also protecting them from hidden facility fees. AHIP will be at the table on all these issues in Washington and in the states. We'll be offering solutions, we'll be responding to concerns, we'll be generating data-driven insights, advocating for stability, for affordability, for choice, for the 200 million plus Americans our members serve. We'll be advocating for a healthcare system that works better and costs less, a system that is more convenient for people, more sustainable for the country, and more equitable for everyone. So thank you again for joining us this week. We really think you're going to get a lot out of it. All of us are. And we invite you to stay connected with us when this conference closes down at the end of the week. So be on the lookout for more information about how you can stay in touch with us and stay connected to AHIP.